as we mentioned, their exercise responses not usually affected by their medications, but as we also talked about as well, their VO2 max is often going to be poor fitness and overall physical activity. Stress, anxiety, exercise is going to help with that, and exercise is effective as medications or meditation. We are doing, or we did the meditation mindfulness, and we talked about all the benefits of that with chronic disease, and it's especially good for people who have anxiety disorders or depression. So you also need to watch for overtraining signs that the people are exercising so much. A lot of exercise can sometimes become a source of anxiety for people. So they can become compulsive, and sometimes high intensity exercise is going to have the opposite effect, and it's going to give them a little bit more anxiety. Or they may want to do a lot of exercise, and it could lead to overuse injuries or overtraining, and they're getting a lot of upper respiratory infections. So some medications. So these are ones that are done primarily for anxiety. Azaspirones or buspirone, that works in your serotonin receptors in your brain. It's non-habit forming. Benzodiazepams, those are Valiums, central nervous system depressants. So those have to be used very carefully because they can be addictive, and those are ones that can be dangerous if they're combined with alcohol. Beta blockers, we know they're used a lot in hypertension and for heart failure, but they can help people with anxiety. And then tricyclic depressions, they work with improving serotonin reuptake in the brain, epinephrine, and some dopamine. Another common group, you may hear of these, monoamine oxidase inhibitors, or MAOIs for short, and these are often used for panic attacks, PTSD, phobias, and you have to really watch out if someone's on these. They may have to, watch for certain foods like grapefruits, and they may react with other drugs. So, and then the serotonin reuptake inhibitors, that's Prozac, selective serotonin reuptake inhibitors, and serotonin norepinephrine. So they work on brain chemistry, and so those have been used a lot, probably the past 20 years or so. Exercise testing and programming, treating them as we talked about, no real difference than a normal healthy adult, other than they're probably generally deconditioned, they have low physical activity. So maybe consider things like, pedometers and Fitbits and other types of activity monitors. And you also may need to work with them if they've got other chronic diseases like heart disease or diabetes, or if they have hypertension. Use perceived exertion if they are on beta blockers. And then, work with the guidelines above with other mental disorders. But typically, people with mental disorders are going to have a high risk of dropout and poor adherence to their exercise program. And here is a little bit more on the Done It All study that is on Blackboard. And what they did is they randomized people into 4 treatments for depression, and then one of the doses was getting people to that, 5 days a week, 30 minutes, 17.5 kcals per kilogram. And then another group did a little less than that. So other groups did 3 days per week. And then there was a control. So, but the people who actually met those public health guidelines of doing the moderate exercise prescription, they actually had about a 50% reduction on their depression scores based on the scale that they were using. And although there were some reductions with the lower doses of physical activity, there really was no different from control. But there was a major decrease in their depression score by people who were active and met activity recommendations.